Welcome to the Omnibus podcast. I'm your host, Jeremy Munson, state representative from District 23B in southern Minnesota. This week, Walter Hudson joins me again to co-host an episode where we sit down with Dr. Scott Jensen for an entire hour to talk about a bunch of different legislation. Dr. Jensen is running to replace Tim Walz as Minnesota's governor, and we talk for quite a long time about gun legislation. Pro-gun, anti-gun legislation, get his positions on all of these different laws. We also talk about the governor's emergency powers and what reforms Dr. Jensen would like to see to that Emergency Powers Act. Then we dive into healthcare reforms to understand Dr. Jensen's experience, legislation he worked on, things he wants to move forward with, where he wants to see healthcare legislation moving in the future. And then we talk about my favorite subject, omnibus bills. And we get Dr. Jensen's experience with omnibus bills, and I'll let you in a little secret. He doesn't like them either. All this and more on the Omnibus podcast, where all subjects are germane. Okay, well, we're joined today by Dr. Scott Jensen, who's recently announced he's running for governor against Tim Walz, and he's kicked off his campaign. We've seen a lot of videos and press. He's been on Fox and Friends and promoting his campaign and talking about the hard issues that are going to be coming up in this next election cycle. And so I invited Dr. Jensen on the show to talk about his position on guns. A lot of people have asked what his positions are. And, so Dr. Jensen, thank you for joining us. And we also have Walter Hudson co-hosting again this week. So the big question, Dr. Jensen, that comes up is, where are you on gun rights? And how do things that happened this last year in the wake of George Floyd's death, in the riots, in the civil unrest, how does that impact your message on gun rights?
Thank you, Representative Munson, Jeremy, if you will, and Walter Hudson. I appreciate being on your podcast and also having the chance to explain, because I think it's important to have a conversation. I oppose universal background checks. I'll just say that right out of the blocks. I know there's been some confusion about my position, and a lot of that stemmed from 2018 when a Democrat in the Senate came to me with about 10 bills and asked me if I'd be willing to have some level of participation. This was in the wake of the Parkland shooting on February 14th, 2018. And I'll be very upfront. I'm not crazy about the way the legislature works. As a first-term senator, it's remarkable how little involvement I have with determining whether we can have a conversation, whether a committee will hear a bill. I mean, we can have thousands of people come to the Capitol, and we can have one person say, we're not having any discussion on that. We're not having any committee meetings on that. And that just rankles me. We did indeed have many, many concerned people come to the Capitol in the wake of Parkland shooting. My feeling was that we need to have a discussion. So when I looked at these 10 bills, there were like 8 of them that I thought were, excuse the language, but I thought they were sort of garbage. And I said, no way in the world. But there were 2 bills that intrigued me. One was a straw man purchase bill, which basically toughened it up. If you hadn't reported a known stolen or missing gun, I believe first level of offense would be a petty misdemeanor. But if it happened again and again, then the penalties beefed up. And I think that's appropriate. The police have had some trouble with chronic offenders, whereby someone who's prohibited and can't buy a gun was getting someone to purchase a gun for them. And then if that gun showed up at a crime scene, the person who bought the gun was shrugging their shoulders and said, well, yeah, that was stolen. Well, then you should have reported it. You still, if you don't know that a gun is missing or you don't know that it's stolen, there's nothing on you, because I've got enough guns in my house that, quite honestly, it could be months or years. And I might not know that, gee, I left my 410 at someone's hunting cabin. So that was that bill. And I think Republicans and Democrats said, yeah, we understand that. And I don't think the NRA or gun owners had trouble with that bill. The one that got me in hot water was the expanded background check bill. And it had tons of exemptions, but not enough. And when Senator Matt Little asked me to sign on to it to help give it some traction, to get a conversation, I told him, it was a Monday morning, I said, I will not support this bill. I said, but I think we should have a conversation because I think that a lot of what we're doing in Minnesota is broken. I don't think that the NICS system is necessarily intersecting with the BCA system, nor are they getting the data from our mental health hospitals. And that's important. I had personal experience with that where my brother, who was involuntarily committed to a mental health hospital, his information did not get forwarded, and he was able to get a gun. And frankly, my brother was prohibited and shouldn't have had a gun. Bruce was a good kid. He's committed suicide. But so I did have some personal involvement there. And so I said I'd sign on to the bill temporarily, but I said I'd like to see the bill changed in big ways.
Well, I certainly agree that the legislature is broken. And to kind of level set things, when you and I both came into the legislature, I came in 3 years ago. You came in 4 years ago. We were both freshmen, and you come in with this idea that if you can just have a good conversation with people across the aisle, that you can convince them that this bill is bad or this bill is good, and you want to work with them on improving legislation. That, after all, is our job, right? To try to, not necessarily compromise, but to either, work with someone in crafting it or changing, moving the bill in a different direction. And after Parkland, when thousands of gun control activists were coming to the Capitol and protesting right outside the House chambers, and it was loud during session, I actually got up and walked out the big double doors, walked right in front of the crowd and said, what do you want? What are you asking for? And, they would, we need red flag laws. And I would actually have the conversation, walk them through who do you want to choose, whether or not it's right for someone to have a gun? The doctor, a neighbor, an anonymous source, someone at school, and try to figure, walk them through the process. And then, of course, if a red flag order was issued and the cops came to somebody's house, we don't know what guns they have. And without a national gun registry, none of these bills are actually enforceable. You can't do universal background checks because that would apply to private sales. And without knowing who has what gun and when, you can never enforce that law. And I think that there was some agreement from that side that what they're asking for is a law that wouldn't have prevented Parkland, wouldn't have prevented most of the shootings, and really just penalizes lawful gun owners and creates more laws to turn gun owners into felons in prohibiting them from owning guns. We need to have that conversation. And I know that you and Karen Housley got a lot of heat for having a picture on social media of you meeting with gun control activists. I posted a picture with Representative Cal Barr and I sitting in my office meeting with Moms Demand Action, and had the comment, having the conversation. And I took heat as well. But it's important to show people that you're talking them through these bills so that we can show them that it doesn't work. Because I do believe, I agree with you that the legislative process is broken. And when we came in, we had the control of both the House and Senate. Republican controlled both. Gun control laws aren't getting through. And when you obstruct people from having a conversation, then it doesn't do anything to change minds on the other side. Walter, you're on the outside of the legislature. What are your thoughts on this, and what kind of questions do you have?
Let me just say, I'm going to attempt here to play the role of the angry Second Amendment activist and advocate, just so that voice has a place at this particular table, and ask a few questions along those lines. So regarding signing on to a bill that you don't actually support and are just trying to initiate a conversation, is that a common thing or even a heard of thing for a legislator to do, to say, I'm putting my name on this bill, but I don't really like it. I just want to have a conversation about it?
That's a great question, and I really appreciate your asking it. It's really quite common, more common than you'd realize. And the Republican leadership in the Senate did that. I was a little surprised at that because the one time I remember, and I'm not going to go into details because I don't think that'd be fair to my colleague at the time, but it was clear that in one situation, they signed on to get others to sign on, and once others had, they took their name off. And that was problematic for me. I was open about it. I was on this bill for about 5 weeks. And when I found that I'd sort of been, if you will, taken advantage of, there really wasn't an interest in having me help redirect or reshape that bill. It was just, they wanted my name on it. And I sort of said nuts to that. And so I started working with Brian Ghosh from the NRA and also with Gun Owners Caucus. And we wrote our own bill. And I remember when I talked with Brian Ghosh, he said, well, I need to run this up the flagpole with the NRA to make sure that they're okay with it. And he said, but what you've really done here is you've created a permissive pathway bill that involves no registration of the gun, nothing more, and makes it very easy for a private seller to go ahead and make certain that they're not inadvertently selling a gun to a prohibited person. There's no fee, there's no charge, there's no records, and frankly, there's no awareness as to whether or not a transaction even takes place. And he said, and so he came back to me and says, yeah, we're fine with that. And then Senator Andrew Lang signed on to it with me. And what it really did was there was more than just a permissive pathway in it. I wanted money to go to school districts that would be willing to have gun training back in their classroom. I want to demystify guns. People blame guns when, frankly, I don't care if they have a gun or a knife or a bomb or a pipe bomb or whatever. It's the person doing it. And we know that. So from my perspective, as soon as I got the permissive pathway bill done and I got sign off from the gun owners and the NRA, I struck my name from the bill with Matt Little. I submitted my own bill with Andrew Lang's name on it, and I couldn't get a hearing for that either. I submitted that the next year, and Andrew Lang signed on it again. And that year, I signed on to a bill with Andrew Lang to toughen up the stand your grounds thing so that we don't have to retreat. But to your question, Walter, it is done with some frequency, and I did it in a couple other situations. And quite frankly, I'm not ashamed of it because the way the system is set up, seniority is everything. It doesn't, subject matter expertise is talked about a lot, but subject matter expertise doesn't get you, and I'm sure Jeremy's seen it too, it doesn't get you what you expect it to get you. Frankly, they tell you to shut up and sit down, and we'd like to hear from you when we ask you.
My follow-up to that would be regarding the phrase you used in your answer there, being taken advantage of in terms of that process. Was this an educational moment for you where you were learning how the process actually works? Was there any concern that by trying to have this conversation legislatively in the context of the legislative process, that you were actually enabling the forwarding of a policy which ran counter to some of the pledges that you had made while campaigning?
Good question. I wasn't concerned about it being a tool that would forward a piece of legislation forward because I knew that I wouldn't vote for it. And a signature on a bill really does nothing other than give it a certain notoriety. But I definitely think that it was an education for me because I thought that there was an interest in trying to see if we could find some common ground, whether it would be the bill that, because I went and after I got my bill done and I submitted, I went to a couple of the Democrats, Matt Little included, and said, would you sign on to this bill? This gets something done. It moves a needle. It does provide an opportunity for people to use the background check if they so choose, but it has nothing that could possibly be sliding toward registration like that. And I was absolutely rebuked. And I was astonished. I thought, well, aren't you trying to find some common ground? And they weren't. It was their way or the highway. And I remember Matt Little being upset with me when I struck my name from his bill. And I said, Dad nabbit, Matt, I said, we had a conversation about this when I first put my name on it. You didn't stick to your end of the agreement. I said that I'd participate to try to get a conversation, and that's not what you were about. And I had conversations with Senator Ron Latz too, and I expressed my disappointment in him as well. So for me, shame on me. I was naive. I guess I put myself in a position where I could have kept out of. But it was really an important lesson, Walter. I learned a lot from that event. But I'm not going to apologize for it because I don't think I did anything wrong. But I can sure understand why strong Second Amendment supporters felt frustrated and angry with me. I get that. I do.
Well, and let's talk a little bit about those pledges. So, and I don't know the particulars of which organizations or what the content of the pledges were, but my understanding was that you signed onto at least one, if not multiple, pledges stating that you were going to uphold Second Amendment rights and not do anything to endanger the ability of Minnesota residents to fully utilize their Second Amendment rights.
Let me jump in, Walter.
Sure, go ahead.
And I did. And I don't think I did sign that pledge. And I don't think I did do anything that would undercut it, because I made it very clear at the front end, this will not get my vote. You do not have my support, but I will put my signature on it to see if we could have, and I did not want a hearing whereby it could be passed out of committee. Sometimes we have things called informational hearings where there's no way they can go anywhere. It's just an informational hearing. And to me, then we could have had that discussion, as Representative Munson said a while back. What are you trying to get here? Do you understand? So I do recall the pledge I signed. When you look at it word for word, letter of the law, I felt that I was still abiding by it. But I can understand where people would not necessarily share my perspective.
I mean, just to be clear, Scott, you never voted for gun control.
Never.
Right. I mean, that's a lot of people question that. And when the Republicans control the House and Senate, you're safe from that bill ever passing. And furthermore, that bill, I mean, it wasn't going to get a hearing, but it wouldn't be amended unless it had full approval of the Republicans and support of what the amendment was going to be.
So it sounds like, Scott, in your view, the pledge was never in conflict with the actions that you were taking in order to have this conversation at the legislative level. Having experienced the blowback from the activists, and recognizing that it's going to be difficult. I mean, let's just be honest about it. It's going to be difficult having this conversation with activists now and saying, no, listen, I am committed to the Second Amendment and to protecting gun rights, and explaining what you've just explained to us, which takes some time. And you have to bring people's guard down in order for them to even be receptive to an explanation. What are the lessons learned, in your view, going forward in terms of how to engage with the process to have a conversation without endangering your commitments to constituent groups?
That is a very insightful question. Would I do it again? What I did? I would not. What I would do next time is what exactly I taught my children and what I teach my patients. I would have said, go back to the root cause. The root cause for me was my frustration with us not having a conversation. I think I should have taken the two bills, had a press conference, and said, I think that the concept of straw man purchase abuse is one that needs to be elevated to a conversation. And I should have done the same thing with the background check bill, because I did not see it as a universal, as they call it, UBC. I do not see it as a universal background check bill. I saw it as an attempt to expand the use of the background check, which I opposed. But I thought it was an opportunity to understand, because I was hearing from a lot of 2A strong supporters like Rob Dorr, that the system is broken, that we don't need to move in that direction. What we ought to do is fix what we had. And I think he's right. And I think if I'd had a press conference, maybe that would have been a better tool to use as a first-term senator to get my colleagues to at least have a discussion, even if it was not even a formal committee hearing, but somehow have a discussion. I think that would have been a better way to go, because it was hard on our family, Walter. I mean, from that weekend, I had death threats, and it was hard on us. And I don't condone death threats of any kind, but I do understand why people were so ferocious, because if I could just tap back into something Representative Munson said a few minutes ago, part of the initial question he asked me was in the context of the riots in Minneapolis in May and June. Well, I'm hoping that what happened then crystallizes the thoughts for lots of us, and not just crystallizes, but reinforces. We cannot take Second Amendment rights for granted. I mean, we didn't know where those riots were going to spill over. We saw some states. I remember a video clip where a man and a wife were in their front yard. They were going to protect themselves, and they had guns, and they were on their property. And honestly, my understanding is that they were being prosecuted. And I'm saying, for what? So, yeah, it was a learning experience for me. And sometimes, I don't know, I've learned more in athletic events when I lose than when I win. And I think sometimes in life, we learn more from our clumsiness and our hiccups and our stumbling and bumbling than when we do something well and it just goes smoothly. So I'm glad for the lesson, because I think it helped keep me out of some other potential difficulties later on in my Senate term.
Looking ahead to the future now, you're running for governor. Obviously, you've put some thought into what Second Amendment issues should look like under a Jensen administration. What would your priorities be on that issue in this office?
Well, maybe I'd have 4 or 5 priorities. Probably the first one, it's maybe an odd one to list first, but it's sort of a negative position. I think that we need to squelch the notion of any value or reasonableness of red flag legislation. I mean, the way it's structured, it's just a violation of our rights, and not just the Second Amendment. And as a physician, I have been in a position where I have put or used 72-hour holds on mentally unstable people. We have legislation on the books that can be tapped into. The idea of a red flag legislation where you don't necessarily even know your accuser. And I mean, literally, you could be an entirely well-balanced, mentally healthy individual, and you could have someone show up at your doorstep and say, you got to give us all your guns or you're breaking the law. And oh, by the way, don't worry about it too much, because if you follow the rules, in 6 to 12 months, you can retrieve them. That's astonishing. So that would be a first priority. Just squelch that. That's just stupid. But we have other pieces, other sections of statute that if you're talking about someone that you think is mentally unbalanced and needs to be removed from their guns, don't take the naive notion that you can go to their doorstep and that they would give you all their guns anyway. All you've done is enraged someone and taken away their rights. And at that point in time, you might have pushed them over the tipping point, if there were such a tipping point. So that would be the first thing, is let's stop with the silliness. The second thing would be a proactive position on mine. I think that we need to look at our stand your ground bills and say, if you're appropriately owning a gun, carrying a gun, using a gun, that you don't necessarily have to retreat. Because I think in the retreating, you do potentially put yourself in additional harm's way. Sort of that old adage, if you get confronted by a bear, the last thing you want to do is turn your back on it. And I'd be worried that people would think that. I also think that, well, let me just take an example here. I believe that Representative Munson has a permit to carry. If he does, and he is on a sidewalk and realizes that in that public building there's gunfire going on, I don't want him to hesitate for a moment thinking that he needs to run back to his car, get in it, and drive back home. I mean, honestly, I would like him to use his best common sense and potentially engage. So that'd be my second priority. My third priority would be to tell people I absolutely oppose any kind of registration of firearms, because as far as I'm concerned, it's not a slippery slope to get at the Second Amendment. It's a violation of the Second Amendment. The Second Amendment says to keep and bear arms, shall not be infringed. It is being infringed if you do that. Fourth priority would be to still get the private seller safe harbor if they choose, and that's something they want. And I think the permissive pathway bill I submitted would do that. And I like the idea of the sheriff's office not knowing. I mean, I would just as soon have it be considered like this. Walter, you want to buy my gun? It doesn't matter whether it's a gun, a knife, or something else that you want to buy. If I want to say, gee, I'd love to know that you're not prohibited. You get me that? And we do whatever we're doing. But even at another level, why wouldn't you, Walter, or me, want the right to be able to go down and get a background check done on us free of charge at the sheriff's office? Because it's our data. What is in there? Why shouldn't I be able to know what a background check would show? And so to me, it's sort of it's confusing that we even have to have this conversation I remember I was a part of the conversation back in the 1980s about should a patient have the right to demand to look at their medical chart? And I remember I got in hot water because I said, absolutely, they should be able to look at their medical chart. And I remember some of the other doctors on the group, I was young at that time, and they said, well, no, you can't be showing patients their chart. What if we said something that we don't want them to know? I said, if you've got something in the chart that you don't want them to know, then you probably shouldn't have put it in the chart. And I feel that way. So I don't mean to be getting long-winded on you, Walter, but does that answer your question?
Yeah. What I'm getting after is that there's a trajectory to your position on guns, and it's pointed in a certain direction.
Fair point.
Well, I want to jump in, and just for people that are really curious about this permissive side of the bill, if you Google MN space 624.7141, you'll come up with the Minnesota statute that pertains to private sales when you transfer a gun. Now, this is just transferring. This isn't even selling, but it says that you are guilty of a gross misdemeanor if you transfer a gun intentionally, which means you're giving it, with knowledge, giving it to someone who has either been denied a permit to carry or they have been found to be ineligible to possess one, meaning they would not pass a NICS test. And if that person uses it in a crime within one whole year, then you are guilty of a felony having transferred that gun. And so that's kind of the liability that your permissive bill was addressing. And, one of the things, we understand if somebody's a felon and shouldn't have one, but there's over 200,000 Minnesotans who have a prescription for medical cannabis under Minnesota's medical cannabis program. And that also prevents someone from buying a gun through a federal firearms dealer. And that may be something that you wouldn't have otherwise known about someone. And that's why it's important to at least have that option available to someone to go out and have a background check done. And then your bill would then remove liability from the person selling it or transferring it and loaning a gun to someone versus what the statute is today. And I think that was an important thing to address.
Jeremy, you're absolutely right. And with our expanding medical marijuana program, this is an issue because you might think, I can transfer this gun to my neighbor with no concerns because he's a really good guy and I know he's never in any trouble. But you might not know that he takes medical marijuana for occasional neuromuscular spasms. Maybe it's only twice a week, but all of a sudden you could find yourself in harm's way. You do raise another point, Jeremy, and that's that I'm not certain that our prohibition regarding people using medical marijuana is not something that shouldn't be discussed, because I don't know that a person using occasional medical marijuana for a legitimate approved indication should have to forfeit their rights in regards to gun ownership. But that's perhaps a conversation for another day. But you're exactly right, Jeremy, that what I was trying to get at is there might be a private sale or a private transfer where some attorney might be able to say, well, you should have known this. And I think that for me, if it's within my family and I know everything about them, that's one thing. But a lot of times I've been at gun ranges where someone say, gee, I really like the way your gun feels. And, we want to do a swap even. And sometimes you just don't know enough. And I'm sort of cautious as a physician and all that. So I'd say, well, I just want to make sure that you're okay. But I don't want any kind of registration going on. And I don't want to intrude on his privacy or mine. So I think that it was worth a discussion. But honestly, I think, Jeremy, you actually bring up points that in a more succinct, understandable fashion than I do. So thank you.
Yeah, well, I actually authored a bill last year and this year, reintroduced it again, that would prohibit Minnesota from sharing the information on the medical cannabis registry to the federal government and to not deny someone the right to purchase or own a gun just because they have a legitimate prescription for medical cannabis. Because that's, we agreed that there's over 200,000 people with that. And we have a legislator in the Minnesota House who has MS, who has who's been prescribed or been authorized to be on the medical cannabis program, but has never taken it. But he, within weeks, lost his permit to carry. They recalled it because of that. So that's a whole, I mean, it is a different issue, but I think it's important to have these conversations about gun rights. It sounds like you're, supportive of expanding gun rights in that manner. So Scott, if you win election as governor, it's important to know we're going to go through redistricting next year, which means we're going to rebalance all of these state house and Senate and congressional districts to be equal proportion of the population. It's very likely that Republicans will be in a position to will be absorbing more Democrats into our districts next year. It's going to be harder to win re-election. So it's going to be harder to win back the House and Senate. But if you win the governor's race, that means we've gained Republican support out there and people have come out and won. And it's very likely we're going to win both the House and Senate. It's very unlikely that you would win the governor's race and we would lose both the House and Senate. But let's just say, worst case scenario, we lost the House and Senate and you happen to win the governor's race and universal background checks came to your desk, passed by Democrats. Would you sign it?
No, I would not.
And same question, if red flag laws were passed by a Democrat-controlled House and Democrat-controlled Senate, and that bill came to your desk, would you sign it?
No, I would not.
And then if Republicans won the House and Senate, and you won the governor's race, and we want to protect gun rights, and we send an anti-red flag law to your desk, would you sign it? Banning red flag laws.
Yes, I would sign that, yes.
And then if we passed a stand your ground law, like you spoke of before, that would protect one's right to self-defense, which so many Minnesotans now feel is so important. Would you sign a stand your ground law?
Yes, I would. In fact, I signed on to Senator Lang's stand your ground bill in 2019 and possibly 2020. 2020 got so disrupted with the COVID.
My question from the perspective, again, of these activists who we know have been very upset about your past signing on to legislation that they regarded as anti-Second Amendment. Look, the fact that you answer those questions without any ambiguity, it's yes or no, and they're the right answers as Second Amendment advocates would identify them. I guess the only question left then is if I'm one of these guys who is looking at you, giving you a little side eye because of past perceived transgressions, what do you say to reassure me that you actually mean what you say when you offer these answers and that you're not just saying what you think people want to hear in order to get the endorsement and proceed on to be the Republican candidate for governor?
I would say that that person is misled in trying to understand my perspective in terms of being willing to run for governor. I don't need another career path. I'm very pleased to be a family doctor, and I was pleased to be a citizen legislator. I'm not going to fall all over myself trying to find words that would be convincing. I would say this, though. I'm sick and tired of losing. We've lost 25 times in a row. And Jeremy has laid out the potential devastation if we lose all three. If we have a Democratic House, Senate, and governor, I think that we're going to have, if we think we've seen a lot of people leave Minnesota now, if we think the Minneapolis streets are being abandoned now, if we think that Minneapolis is a city in trouble, perhaps with a future like Detroit, Michigan, now, if we lose all three in 2022, wow. And I think that the fact that I've been willing to have these conversations, the fact that I respect voices that don't speak the same message I do, at some level has got to be a positive. Yes, I've had my picture taken with mothers demanding action. The one I think that I've seen the most often is a constituent as well as a physician colleague. And the two of us have shared responsibilities in taking care of people whose at times lives were on the line. So I'm not going to apologize for taking a picture with someone that comes down to the Capitol to share their voice. But I've been about as clear as I can be that I think Second Amendment rights are critically important. And I think with what's happened over the last 12 months, not just with the riots in Minneapolis in May and June, but also the willingness of the present governor to take emergency powers and literally use it as a tool to get whatever he wants. This should crystallize all of our thinking and say, damn it, we've got to stop losing.
On that same line with the governor's powers, a year ago, the governor locked down our state, shut down our schools, shut down bars and restaurants, closed our economy. There were a handful of us in the House that quickly researched what 12.31, the chapter of law, was, what it means, how he got these powers, and started pushing back and speaking out against it. And the only one in the Senate that popped up speaking up about our constitutional, rights and how the Constitution should restrict the government and talking about how lockdowns don't work was you. And you've been fighting for people's individual rights this entire past year, and you've gained notoriety for it because you're so outspoken and in speaking in an intelligent manner. And for Second Amendment supporters, the Constitution is so important, and limited government speaks to people who support the Second Amendment, and it applies to what the governor has done with infringing on everyone's right to live their life, run their business, provide for their family. As governor, if you were to win the governor's race, would you support signing a bill that would alter Chapter 12.31 to not only remove the legislative veto or the legislature's requirement to have both bodies override the governor, so where then they would have to positively, vote for the law, but would you also be supportive of preventing the governor from inflicting fines and penalties as he's done with these laws?
Well, yes to both your questions. First off, with the emergency powers, I signed on to a lawsuit against the governor with you, Jeremy, and several others. And I don't know how many senators did that. I also wrote a check from my personal account to support that lawsuit. I would be this is so powerfully important to me to see this never happen again. That if I were governor, I would be inclined, I'm not going to put myself straight up, I would be inclined to tell the legislature that I am not inclined to sign my name to any bill unless the first bill to my desk is to rewrite emergency powers. This is beyond abusive, what Governor Walz is doing to us with emergency powers. I remember Sunday of, I think it was like May 18th last year. I was driving down to the Capitol, and this was our last day, and I knew we'd go late into the night. And I wanted the Senate to vote on taking away the emergency powers from Governor Walz. We did not have that vote that day. I was furious, damn near in tears. I remember speaking to a guy named Jake Duesenberg, I think, on the way down for about 30 minutes. And he's not the easiest guy in the world to talk to if you're talking about a topic that he's passionate about, because he's very passionate. And I remember telling him, I will do what I can, Jake, but I can only do so much. And I think he was disappointed in me. Fine. But I remember explosive caucus discussion. And I lost. And on that day, on that Sunday, we did not vote in the Senate to remove his powers. And honestly, that's the day, the last big day, that we really had the potential to stop it. Now, Governor Walz has made it clear he is not going to relinquish it. It has nothing to do with emergencies. It has everything to do with the tool by which he can get something from the divided legislature that he wouldn't otherwise be able to get. Literally, he's asking the senators, the Republican senators, to negotiate to get those emergency powers to go away. Dave Osmek put a bill forward that makes a lot of sense. If you get emergency powers, you got them for 30 days. Doesn't matter what your executive council says. And the only way they're extended is for both bodies to agree to continue them. But even there, Jeremy, I'm not certain that that's a strong enough position, because you could conceivably have both bodies be the same party as the governor. So perhaps we almost need to say that if both bodies are controlled by one party, is there a way that we should be thinking about a supermajority, or should we be talking about that? I mean, frankly, the legislature and the governor don't have to fight. And if it's a true emergency, which should be guided by the statutes, there shouldn't be any disagreement. I mean, if we're having floods wipe out 50% of the land in the state, good grief, that's emergency powers. But we don't even have a well-crafted piece of statute there guide us in terms of public health, because public health is so fraught with the bureaucrat's perspective, the epidemiologist's perspective, the physician's perspective. What we've learned through this process is this is slimy and murky and difficult to discern. So I just don't think that Minnesota should ever be in a position like we are now again, ever. And I don't know that we have the right best piece of legislation proposed yet. But I think Dave Osmick's, that both bodies have to approve it, would be a first step. But I don't know if it's enough.
Representative Mortensen and I and John Poston and a few others have authored a bill that goes much further. And because one of the concerns that business owners have, restaurant owners and such, is that the governor can write a law and then put fines and penalties. He can make it a $3,000 fine, and so he's writing law and enforcing the law, putting fines and penalties behind it without the legislature's approval. And so if he wants to write rules to change regulations from the MPCA or the DNR to have temporary authority to divert water to this river, like going around laws, that's one thing. But when he starts inflicting penalties and taking away people's right to provide for their families, we don't think he should have that authority. So it's basically saying if he wants to write a rule on something, the legislature would have to approve it after 30 days, but only the legislature can write real law with fines and penalties and make things criminal. Because there's also the risk that the governor can declare an emergency, write laws, and then on day 29, he can end his emergency and then declare a new one the next day, and it would never get to the legislature.
Yes, truly, Minnesotans are paying the price for sloppy legislation. I think the original format was maybe in the 1960s, and then I think it was revised some right around 2003 or 4. I don't remember exactly the date, but we're paying the price, and Minnesotans are paying the price. And I would challenge anybody who does not think that Governor Walz should give up his emergency powers right now to tell me what moment by moment, day by day thinking and decision making is so important that we have to literally push aside the idea of three branches of government. I mean, Governor Walz is not utilizing the Judiciary Committee for oversight. And he has certainly thrown the legislature under the bus and said, I don't need you until it comes time for the budget to be passed. I don't know. I just don't get it. This is an abuse of catastrophic proportions.
And it sets a terrible precedent so that if we have a seasonal flu epidemic, that where we have 80,000 people in the United States dying from the flu, which we've had before, what's to prevent the governor from declaring another emergency, putting in place 6-foot, 12-foot, 28-foot social distancing rules for schools, or whatever he deems necessary to mask mandates again. And so it's important to address these emergency powers now, or as soon as we get a governor who'd be willing to sign them, so that we can prevent this from happening in the future.
And I think people might think, well, that's not fair to accuse someone of being so petty as to potentially do that. I don't think Minnesotans should be so naive as to think that politicians would abuse power in such a way, and we don't have to be so worried about some of these things. But honestly, if there's one thing I've learned about politicians, it's that they will use whatever tools they can. And if they need to bully someone, if there's someone getting out of line in terms of their voting, they will do that. So do I think that you could have a situation where someone might literally, knowingly go ahead and grab onto emergency powers, despite the fact that they might not believe that it's necessary, but it would be convenient or it would be helpful to get an agenda accomplished? Absolutely, I think politicians would do that. I really do.
So I'd like to jump into talking about some healthcare reforms. When I came into legislature, my primary goal was, bringing free markets to healthcare to lower the cost of care, because I saw Republicans, were subsidizing insurance premiums, and Democrats wanted to socialize health insurance and eventually healthcare. And I didn't see either of those as being sufficient. I'm self-employed, so I buy private insurance, and the premiums were over $30,000 a year with a $12,000 deductible. And it just wasn't insurance as far as I was concerned. So I wanted to do price transparency and free markets. And you had some legislation that you were carrying. I carried some in the House and tried to have the conversations, but I found out that I was being blocked by Republicans, and big insurance companies and hospital associations were pushing back, not wanting to have price transparency, not empowering patients. What type of reforms do you see? Do you want to have the conversation about in your campaign and as governor of the state? Where would you like to see healthcare go?
I think we have to keep it privatized. I think a government-run system, we're going to have so many problems. I mean, in a sense, we have a little bit of a model to look at with the VA. And I think, in a sense, that's a government-run program. And I'm not trying to denigrate it, but it doesn't work like a smoothly run machine. I have an awful lot of veterans who come to me for their care all through the year, but they maintain a relationship with the VA once a year so that they can continue to get their medicines. And I think it makes sense. They've earned that. I mean, they served our country. One of my goals, and perhaps as a physician, it was elevated beyond that, which other legislators might hold us. I would like to see everybody in Minnesota have some basic package of care such that if they get an appendicitis or they have a heart attack, that even if they're uninsured, that they wouldn't have to get a second mortgage on their house or declare bankruptcy. And I think we're so close at 6% potentially being uninsured. I think we could do something like that. So that was a priority for me. Transparency is huge. I might disagree with you a little bit, Jeremy, on the concept of driving down prices through competition. I think that in the same way that we have a public utility commission for Xcel Energy, I think that sometimes you get a monopoly created that it would be hard to go fight against that. I mean, we might only have a half a dozen centers in the state that can do certain complex surgical procedures with and still keep the death rate from the surgery low enough to make it feasible. If we didn't have any kind of regulation on that, instead of charging $40,000 for the operation, why wouldn't they charge $100,000? So I think we have to realize that in medicine, we do give at some level a monopoly. Now, I'm glad for the work that I was able to contribute to, and I know you did as well, with insurance companies. We were able to bring in for-profit insurance companies into Minnesota. That was important. Prior to that, we had, if you will, the big three were Blue Cross Health Partners and Medica, and they had monopoly. And that was why I voted for MinCare buy-in as an amendment that failed in 2017, was they came to us and said, oh, we're not going to be offering any individual plans in these counties. And I said, the hell you aren't. I said, you've got to offer individuals. I don't care if it's Kitson County, you don't make enough money off of it. But the bottom line is we can't let them have a monopoly and say that we're just going to sell to those markets that we know we're going to make money on. For the guy or gal who's got a private business, small business, one or two people, for them to find out that, gee, if I don't get my health insurance through my employer, I'm my own employer, and I'm not eligible for MinCare or MA, you mean to tell me my only option is to go to the exchange? And the exchange is flawed in terms of Obamacare, because if you look at the way exchange priced out, if you're in this portion of it, you pay 10% or less. But if you're over the threshold, there's a rate cliff. You can pay 30%. So that's a flawed piece of legislation, and you're driving them to that. So I just basically let the big three know that if you want my support, you better get your butts out there and get an individual plan for every one of the counties. And 2 or 3 weeks later, they came back and said, yeah, we'll do it. So that was another one of those votes where I got in a little hot water, but it was the right vote to make. And I remember telling Paul Gazelka, I said, I'm making the right vote. You're making the wrong vote. And I still believe that. We agreed, Jeremy, on the overarching goals, but I would like to not have an appendicitis or a stroke or a heart attack cripple a family's finances. And yet, on the other hand, you've got to have skin in the game. You have to have shared cost sharing, because otherwise people come into my office and I say, well, yeah, you got a bronchitis. We're going to put you on an antibiotic. And they say, well, you know what? It's not that I disagree with you, doc, but I'd like to have a CAT scan just to confirm I don't have lung cancer. And I said, well, why would you even think that? And they said, well, my neighbor just got lung cancer. I said, yeah, I know your neighbor. He smoked 3 packs of cigarettes a day for 40 years. You've never smoked anything. I said, that's just not responsible utilization. And he said, well, I'm not paying it. I already paid my $10 copay. And I said, well, that's just not right. And so, I mean, we get into these goofy situations. Healthcare it's a funny animal. I mean, you don't ever solve healthcare in a 10-minute conversation.
Yeah, that's true. And, you know, you and I served on that US of Care group where they were taking Republicans from the Senate and Democrats from the House. And I was there because I had some other ideas on healthcare, and we had really productive conversations. It was behind closed doors, which I think sometimes you do have a little more honest discussion with people from across the aisle. And we met, weekly for quite a while talking about different provisions. And, as a self-employed person in Blue Earth County where I live, there was only one plan. We're only one provider of healthcare. It was Blue Cross Blue Shield on the exchange. And maybe when you talked with the providers and it forced another one to come into the market, there was another one on the exchange, but they only had like 1,000. They only took 1,000 people. So it filled up in a day, and that got full. And so it was, again, down to one provider. So there's a line that I push for free markets in healthcare, in private healthcare, but I also don't like crony capitalism. And it takes a certain kind of legislator to stand up to the lobbyists and special interest groups in St. Paul and in fighting for patients, which you've seemed to have always been doing, and making sure that patients are part of the conversation.
What you're speaking to there, Jeremy, is the perpetual and important fact that there is no lobby for the unforeseen outcome, right? So when we talk about there being monopolies or oligopolies, where there's only a few care providers providing high dollar procedures, well, is there a reason behind that is not apparent? Is it a regulatory issue? Is it impossible for anybody else to come into the market and compete? If we were going to have that hypothetical $40,000 procedure that suddenly shot up to $100,000, given current market conditions, absent regulation, why wouldn't somebody come in and try to compete to bring that price down? And if we can identify that answer, then let's address that. The problem is that the reason why very few people, Jeremy, when you talk about a certain kind of legislator, you're talking about the kind of legislator who can see that and is willing to pursue what is truly, objectively, the best public policy, as opposed to serving a lobby or an interest group. Because there is no lobby or interest group for this imaginary competition that doesn't currently exist because of the status quo in our regulatory apparatus. So I guess my question for you, Scott, and it sounds like you've started to choose some of these things out, is do you envision any sort of unconventional approaches to healthcare that you're going to have to go out there and fight for, because there isn't currently a group of people who are saying we specifically want this, we specifically want that. But given your knowledge and your expertise and professional background, you recognize that this would be the right way to go.
Yes, those are great questions. There's three things I want to sort of unpack out of it. First off, Walter, to your question, why wouldn't someone come in and say, well, we're going to create something where we could go and instead of charging 100,000, we only charge 80, and we're still getting paid really well. There's multiple things. One is most of those kinds of high buck procedures are hospital based, where you can't build a hospital because there's regulations against it. And so you can't go out. If the three of us put all our money together and wanted to build a 1-bed hospital, we still wouldn't be able to. So that would be one. The other thing was the insurance companies might not let us in. And as crazy as this sounds, we have to remember that with insurance companies, they make their money based on a certain percentage of total revenues in. They've got to pay a certain portion out. Just for discussion's sake, if an insurance company brings in $100 million and they've got to pay out 80% of that for actual care that patients received, and then they can keep 20% for admin, well, if they have that restriction, how do they make more money going forward? They let the pie get bigger. So they would let the 40,000 procedure go to 100,000, theoretically, not realistically. But what that would do is that would give them a chance to grab onto 20% of that pie. And that's one of the problems with insurance companies is there's a disincentive sometimes because they will get more money for the admin piece, which is where they get their salaries, if they let the pie get bigger. So it's not necessarily intuitive right off the bat. And I think in terms of patients having access to free market share and competition, I think what Jeremy was saying, we can do that with elective procedures. You used a good word, Walter. You said unforeseen. That unforeseen part is where you can't negotiate. When you're having a heart attack, you're not going to really see which hospital does a 20% discount on Sundays. So you're going to just go wherever they go. But for 60 or 70% of our healthcare, it is not unforeseen. My wife's a veterinarian. You go out and buy a dog. You know you're going to see the veterinarian at least twice that year. You know you're going to get your heartworm. You know you're going to get your vaccinations. And that's part of what you have to consider when you buy the dog. We can do some shopping there. We can say, well, my kid's going to get a cold. He's going to need some shots or whatever. It's the unforeseen piece that throws the whole system out of whack. So we may have to make a division there. Because if we could get patients to be good, responsible consumers on the side that they can control, that'll spill over to the other side, I think. So that, because right now we have patients that they go in the hospital, oftentimes for a heart condition, they give up control. They think whatever the doctor says. And quite frankly, we order too many tests and we send the patient out on, well, you're going to get this test monitoring your heart rhythm for the next 30 days. They never had a damn arrhythmia in the whole hospitalization. We just monitored their heart for 4 days in a row. They had no problem, but we still sent them out on a test that's going to cost $2,000. Come on. There's a lot of abuse and gouging going on. I got myself in big time hot water because I said that you could conceivably have hospitals enchanted by the notion of having COVID-19 be one of the diagnoses on the discharge summary, because if you have 161 of those between January 1st and June 10th, you get $77,000 per admit more through the TRICARES Act, through the CARES Act, yeah. And people said, you're besmirching our reputation as doctors. No, I'm not. We've done a good enough job of that on our own. And then one last point, Walter, you said, would I have any crazy, wild ideas as to how to fix this? Yeah. I would open it up. Let patients have options other than just Western conventional medicine. Chiropractors can do a lot of things at a lot lower cost than physicians because we're always stuck on pills and surgery. Let people have choices. With the COVID-19, why in the world we didn't have public health messages going out telling people that it was theoretically possible and maybe even likely that vitamin C, vitamin D, zinc, and a 5-pound weight loss with a 15-minute walk 3 times a week might strengthen your immune system so that if you got COVID, you had a better chance of surviving. I never heard that public health message. All I heard was physical distancing, wear your mask, yada, yada, yada. That's why there's no public trust right now between the common man and the public health departments. It's not because the common man is buying into conspiracy theories. It's because the public health departments were so tone deaf to what was going on in the world that they planted the conspiracy theories by being so passionate against anything other than what they had to say. And they've got to own that. Not you or me. They've got to own it.
That raises a broader question that is obviously related to healthcare policy, but has bigger implications as well, regarding liability. So I think a big part of the reason why the public health conversation went the direction it did over the course of the past year, you could have a question about the motives of the individuals who are making the decisions, but what environment were they operating in that gave them those motives? And I think you have to look at legal liability. You have to look at the fact that businesses don't want to be sued because somebody says they contracted COVID-19 or anything else on their premises. Have you put any thought into liability protections, potentially not just for this, but for just generally tort reform and greater liability protections so that we litigate less and live more and make choices in the market to protect ourselves?
This is ironic that you asked that question, Walter. 12 and a half months ago, March 6th, I just gotten back from a business meeting in Florida a couple of days earlier. And I think that was the timing, but anyway, it was March 6th. And I gave a talk at the Midland Hills to a bunch of chief medical officers of hospitals around the state. And we knew that we were moving into this COVID-19 situation. I don't think it had been declared yet a pandemic. It was right around then, because I remember the lockdown came March 17th. But I remember asking this group of people, is there something that you would want from us as legislators other than personal protective equipment and money? They said, well, no, those are the two big things we need. And I said to them, because I took some criticism for this, I said, would you not want us to think about some liability protection? Because you are going to be put on the cutting edge of making decisions that have never been made before. And you're going to try your best, and you're smart people. But it's possible you're going to make the wrong decision. Would liability protection be something you might want? And everybody sort of went crickets. So I ended my talk and I left. And I talked to someone later on about how the speech had gone. And they said, well, they liked you. They thought you were a good speaker, yada, yada, yada. But they were a little insulted by the fact that you brought up liability protection. And I remember being irritated. And I remember telling that person I was talking with, I said, well, nuts to them. Because if all they want to do is ask for gowns and masks and gloves and goggles and money, but they're not giving a thought to the fact that they might put themselves in some pretty deep doo-doo by trying to make a good decision and potentially making a bad one, I would think they'd be less short-sighted than that. And she said, well, this is just where they're at this place and time. And I said, fine. But I've never forgotten that, Walter. I tried to raise the issue that there is an issue. Now, in terms of standard liability protection for me in everyday care, it's not as bad as you think it is. I mean, doctors complain about it all the time. But in my clinic, I think we're paying somewhere around maybe $7,000 or $8,000 a year per physician. So it's not, maybe even less than that. But we don't deliver babies and we don't do any major surgery. But I mean, the MMIC it's a rock solid malpractice insurance company, and they've done a good job, and they've helped us understand what we can do to hold it down. There's still problems, and I appreciate you bringing it up, but that's a long discussion, and I'm going to be hoarse by the time I get done with that one.
I have to ask you a question that is really important to me, and I want to know how you stand on it, and I've been bringing this issue up quite a bit over the past few years. Our state constitution in Minnesota, Article 4, Section 17, says no law shall embrace more than one subject, which shall be expressed in its title. What does that provision of our Constitution mean to you, and what will you do to support that?
Well, thank you, Jeremy. I mean, you're basically talking about omnibus bills, and I had a constituent see a commentary I put in the Star Strip, this Minneapolis Star Strip Tribune, expressing my frustration and anger with the leadership for doing another omnibus bill. I think it was a supplemental spending bill. And he went and cut the article out and got it embossed on a very nice piece of wood and gave it to me and said, I hope you never forget this. And I did never forget it. But I did vote for another omnibus bill because I had no choice. I think that we should stick to the Constitution. And if I were governor, I would let the legislature know, if you do this, I will go to the public, I will go around the state, I will show the people what you're doing to me, that you're trying to corner me with some good stuff and some bad stuff. And you've got a mixture of stuff that has nothing to do with each other. Some of it's public safety, some of it's healthcare, some of it might be naming the state horse. And I said, I'm not going to tolerate it. The omnibus bills are one of the biggest abuses. What it does is it shields legislators from taking the tough votes and letting their constituents know how they're going to vote. It's one of the worst things we've done, and we should absolutely stop doing it. But every time you get the leaders, they move up through the ranks, and then, boom, they embrace them. I'm sorry. We got to stop that.
I mean, it was disgusting that I couldn't hold legislators accountable for their votes, because you say, why did you vote for this bad thing? And they're like, well, because this one good thing was in there too. And they use that to kind of decorate it like a Christmas tree to get the bills through by, handing out bills to legislators. But I also found out that, and I experienced this, where the lobbyists have legislation that no one would vote for in, good conscience. Nobody would carry it through on its own merits, but they attach it to omnibus bills to slide it through. So you have this core of an omnibus bill that's lobbyist handout, special interest groups legislation, and then it's wrapped with layers and layers of legislation that, one piece here might be good and bad, but it's frustrating when these things come together. And then usually at the end of session, leadership compiles these multi-subject omnibus bills, and then you get one vote up or down. And I've heard you on the Senate floor making good arguments against these abuses. And so I just want to know, as governor, that you would just veto it, send it back, and say, send it to me in pieces because I'm not signing it.
I remember over and over, Walter, you might find this amusing. I don't think Jeremy will because he's been there, but they call it the fruit basket. So they're putting together the fruit basket. And if it's not quite enticing enough, well, let's add more fruit. We'll put a banana in there. We'll put some grapes in there. That's the way legislation is made. They sort of casually and glibly say, well, that's what happens when you make sausage. BS. That's what happens when you want to hold your seat, when you want to play games. The public is not served.
Well, and it runs counter to the rhetoric that literally everyone who runs for office is constantly spouting during campaign season, which is, I'm all about the democracy. I really care about the people and the constituents and this democratic process. It's so sacred. We've heard that word used quite a bit this year, the sacred space of our public house and what have you. Yet you're not treating it as though it's sacred. You're not treating it as though you care about what the people want, because if the people actually wanted each of these individual things, then you shouldn't have any trouble getting them passed on their own merits. The fact that you're doing this fruit basket approach to legislating indicates that you're trying to move things through that you know people don't want. It is specifically and intentionally anti-democratic.
And I'll add to that. I mean, my experience is that when I talk to constituents, they want me to work across the aisle. Even in a deeply conservative district, they say, there's got to be bipartisan stuff you can work on. And I say, there are. There are a lot of really good bipartisan bills that would pass the floor, all green votes, but they hold on to those. The party in the majority holds on to those and then starts attaching partisan legislation to that good bipartisan piece until it becomes almost unpalatable for the minority, and that's when they vote on it. So they take the good stuff and they make that part of the omnibus bill.
It was a remarkable experience for me to be in the legislature and be used to this scientific methodology we use in medicine: observe, measure, hypothesize, create an experiment to determine whether or not our hypothesis works. And then to go to the legislature and see this very heavy-handed top-down system, entirely seniority-based. Subject matter expertise is something that's bally-booed around, but really doesn't get respected too great much. I can absolutely see why people are turned off by it. And I don't know. I mean, I honestly don't know if in my lifetime we can walk it back. But if I got a chance to be the governor for 4 years, I'll tell you, we'd shake things up. And part of the reason we'd shake it up is because I have no interest in being a politician. None. Zip. Zero.
Thank you for this great conversation, Scott. You're running a great campaign so far, and I look forward to seeing more of your videos and the message, and seeing you out on the campaign trail, talking to people, tackling those difficult conversations. And thank you for being so honest with us on the show today.
Yeah, I just want to say I really appreciate the fact that this is, from my perspective, been a very genuine, sincere, good faith conversation. I don't see you looking at notes. You've been given off the cuff answers. You've really been thinking about and considering the ideas that we're discussing. And that shouldn't distinguish you from other public servants and political candidates, but it most certainly does. So appreciate you coming on and having that conversation with us.
Thanks for having me. I am running for the governor's post next time around. And the reason I am is because I think we are seeing failed leadership. I know Governor Walz works very hard, but I think he's been surrounded by an echo chamber, and I don't think the path we're on is sustainable. I think we might kid ourselves as Minnesotans thinking that things will return to normal. Minneapolis is going to be a long time coming before it returns to where it was. We're going to be a long time coming as Minnesotans to return to where we were in terms of being secure in our rights. I'm afraid that the rubber band has been stretched so far out of shape that it may not be able to spring back to what it was. And that makes me fearful that somehow emergency powers and throwing science to the wind, science that had been in place for 20 years, will become the norm. Science has been sacrificed at the altar of fear, and fear has been played. I would be a unique outsider candidate. I would be respectful, no rocks and cows, no 19-year-old cooks. I would be a truth teller because, quite frankly, I have no reason not to, and it's a lot easier to deal with tomorrow if I just tell the truth today. Then I don't have to wonder what I said. As a physician, I've been the voice for my patients for 35 years. I'd love to be the voice for all Minnesotans, both sides of the aisle, those who've been listened to and those who haven't. I think our state needs to be healed. I think we could be nation leading. I think we could say, you know what? Watch Minnesota, and you can do the same. And maybe, just maybe, we can find an equilibrium that looks like a democracy. Thanks for listening. My website is drscottjensen.com, DrScottJensen.com. I'd love you to go there. You'll see my positions. And if you haven't seen our launch video, you might think it's worth a while. Thank you.
Thank you, Scott, for the honest conversation. And we really enjoyed visiting with you.